After a break, again, we are gathering here to hear from our beloved Basaraj sir. That many words are coming through him. Actually, it is from a divine source. Today, he is dealing with the auricular therapy. Many of us knows that the auricular therapy is using for diagnosis as well as treatment. He will let us know about all these items, how to do this auricular diagnosis as well as auricular therapy for diseases. Before that, I want to mention that our TEM class, Traditional Energy Medicine class, will start in continuation with the 3 days. Of course, we know that every course from him is a new one. So if anybody want to repeat the course, how to please contact our Joshi sir. He will do the necessary thing, however you want to repeat the course. And of course, this auricular therapy is one of the main subject in the TM course in the coming diploma course. Okay. Now we can very happily invite our Basavara sir to this platform. Good evening, sir.
Namaskara.
Welcome to this platform, sir. Now you can take care of the session, sir. Thank you.
So thank you very much. Very few people are video on. You can on your video. Let's have some interaction. Hi Syed, Sitaramadu. Hi, Gnanashekar, how are you? Fine.
Hello, friends. Basavara sir requested you all to switch on your video. Video should be on throughout the class. Please.
Not throughout. I think after long back we are meeting. And
okay, sir. Okay.
So I took little gap. Again, in that gap, we did some predominant research for Nadiswara. I hope from today, another 3 to 4 months, our journey will continues. Again, in this 4 months, definitely we will share many more things, which is very useful for your practice, and as well as you can see the great magical results. So what we achieved, single point results. Even myself, I started multi-needling in 2008. That ended with a single point and getting great results. I think here more than 100 people's already TM students are there. How is your practice in last 1 year after attending the class? It's great. Fine. So it's the 2 things from today we started. One, for all TM students, we need to upgrade their knowledge. The second, we need to bring few more new people into the TM, Traditional Energy Medicine course. In upcoming TM course, we are including in these 3 days, I'll give you some glimpses of auricular and in-depth course. It's included in the course, TM course. Why we are selecting? Already we are achieving great results with single point, and we are correcting even with food and even with exercises. Apart from that, we are also using colors. That is also doing wonderful magical results. For that, today we are going to add one more. That is auricular. The reason for choosing this auricular for TM student is, all of you know that in yoga, in our body, there is a 72,000 nadis. out of which 12,000 nadis will end in the year. Just imagine there's a 12,000 nerve endings in the year. The another great thing about auricular therapy is it is very quick results. Why that much fast change we can expect means around the year, almost all 6 yang meridians are passing. All yang meridians are around the ear. Take gallbladder, triple wormer, small intestine, even stomach also, even it starts here, it goes near the ear and comes back. So, you know the nature of yang. What is the nature of yang? Quick change. The same quick changes you can expect through auricular. The moment you start treat with auricular, one or other way, you are enhancing the yang meridians. What is yang again? It is a function. So in TM you learned yin is a nourishment. Yang is a functionality. To improve a functionality of the any tissues, any dhatus, or any organ, we can increase by enhancing the yang energy in the body. That we are achieving through auricular. So here also, people may here practice already auricular using many different points. We try to summarize and use effectively, try to achieve results within 2 or 3 points. 1 or 2, maximum 3 points. We should reach our aim, what you are doing. If you want to achieve that, okay, one person comes with some or other multiple illness, he may tell 10 different symptoms, but it's your expertise to summarize all 10 symptoms and to select a 2 auricular point. Select 2 or 3 auricular points. With that, you will get the results. See, most of the learnings happens through patients. They're telling very clearly, sir, you applied some magnets in the ear. Till that it is there in the ear, I'm fine. Day before yesterday, it is fallen down. After that, again, symptoms are reoccurring. The symptoms recurring after falling down. So, a very clear observation. The symptoms are subsidized till that patient pressing that particular ear point. This means what? What single point you do? We are applying methi or pepper 10 minutes. That is doing energy correction, no doubt in that. But if you put 2 seeds in the ear and tell the patient to press whenever they remember, maybe at once, 5 times, 10 times in a day, just triggering a few seconds and leave it. That will take care. Like other microsystems, most of you are familiar with Sujok. You are using a finger microsystem. Some of you are using some other different microsystems, even iridology, even facial diagnosis and treatment and all. This is also one of the microsystem. And it is exactly replicating your macro system. Body is your macro system. The entire body is replicating, reflexing in the ear. Means through ear, you can touch any part of the body. To do that, we will need to summarize some more things before doing auricular. If you know the concepts of meridians, chakras, and reflexology, you can do better way. Why? Because I will give you a simple example. So all of you know that which meridian it is. Is it visible? You can text in the chat box or else I will change. It's a liver meridian. Okay. So before doing auricular, if you know the position of the meridian, including the divergent meridian of the each one, and which are all the tissues and organs the each meridian will cover. These things you can include into your auricular. For example, if any person comes with a problem of some genetical organ or nearby, for example, many people they will get some itching around the genetical organ, or some varicocele, or some dryness in the vaginal area, or some extra tissue growth, some other having some fungal infection and all. So if you take the first concept, a reflexology, in the auricular, directly you can go there. You can get into the reflex of the testicles or pelvic groin area. You can treat, but you cannot achieve a full results by just activating that area. If you have a knowledge of which are all the meridians which is passing and controlling that, and which energy is influencing that. For example, so that groin area is controlled by liver. Along with that groin area, you can put one more point for the liver, so that cure will happen within few days. Instead of using, if you go with auricular reflexology, which is already people are practicing, it takes little time if you go with only reflexology concept. Let's mix some the concept of Ayurveda and TCM into this. The second point, I choose liver. Why I choose means because of the liver meridian passing across the groin area. This is enough. You'll get complete good results. If the patient complains, one more thing, too much dryness and itching, then I will select one more point, lungs. Why I select lungs? Because lung is responsible for moisturizing the skin. It's too dry and itchy because it's not moistured. The dispersing nature of lungs Who will disperse the water? For example, if water flowing in the river, if the water flowing is there in the well, if the water is there in the sea, will it disperse? No. There is a boundary for that. Even though kidney and spleen also controlling the water metabolism in the body, for them there is a boundary. For them there is a boundary. In particular channel or in particular digestive system, they are controlling the water metabolism. But lungs are not like that. Just imagine lungs with your atmosphere. How it will do? It will take water from the well, from the river, from the sea, from everywhere it will take and converts into mist, fog, rain, and it spreads all over the earth. That is the job of lungs. What lungs will do means you should always remember what the atmosphere is doing for us. It's not only giving the oxygen to us. Do you think the atmosphere job is for breathing only? No. That lungs is responsible for moisturing entire area. It will moisture in different way. In rainy season, it will moisture the earth with rain. In the winter season, it will moisture the earth with what? With fog. Some other way. Similarly, lungs, which is responsible for spreading the water and dispersing across the body. If any of you complaining your skin is not moistured, if ears are not moistured, it's dry. Even if you are losing weight because your muscles are dry, all these complaints, it's because of dysfunction of your lungs. If you strengthen your lungs, everything, every part of your body will get moisture. So that's what I use a third point. Lungs. So what are all the knowledge is required to achieve good results? The first, auricular reflexology, to choose where it is reflexing, where it is reflecting, where the groin area, ear, liver area, ear, to identify that. The first we will learn reflexology of the auricular. The second concept is which is required is meridian flow. When you're treating any reflex of the any part of the body, you should have a simple concept of which meridian is flowing there. Which meridian is flowing there. The third concept is which energy is required. Here, if any fungal infection, dryness, itching of the groin area, what is the concept? The energy is excess dryness. Energy is dryness, meridian is liver, and reflex organ. Clear for you? These 3 points are enough. If you want to do, if for me, I think many people who visited my clinic, I use 2 points, auricular, and achieving very good response and feedback from the patient. 3 is fine. If you feel even fourth auricular also fine means, then you can go with chakra. First is reflex, meridian, energy. Sir, chalta hai sir, even one more point also fine for me. Then you can choose chakra. How the we are in Ayurvedic concept. There's 7 chakras. The same 7 chakras we are showing you in the ear. Reflex. For example, as I told you, the fungal infection or dryness in the groin area, which chakra will come there? It's the Mooladhara. So you can put one more seed on the Mooladhara chakra or root chakra. Got it? So like that, even I'm not telling you you are treating the symptomatically. No. Even the patient complains multiple symptoms. If the patient is telling multiple symptoms, how we are compressing that? Patient comes, tells headache, gastric, neck pain, knee pain, constipation, indigestion, diabetes. Normally, if anybody coming to you means you are the last hope for them. As a first hope, they go to the doctor. If multiple symptoms are there, here your TM class which you took, that will help you. What you learned in the TM class? In depth, you learned the each and every meridians and energy. Even though patient tells multiple symptoms, with the knowledge of TM class, you can comprise that, okay, this patient is having spleen Chi deficiency. Due to that, digestion is weak. Due to digestion weakness, that sinus and headache is happening. That is, you have to compress. Maybe you have to put little more effort in this area. Somebody simply tell back pain. But it is not easy for us to tell which organ is responsible for it. Many people simply tell low back pain, it is the kidney. Few people will tell it's a urinary bladder. It won't happen that. I think you may have observed. It's not easy to get the result by just treating one or other meridian. Here, you should understand the concept of triple warmer. You learned that. So your body is divided into 3 warmers: upper warmer, middle warmer, and lower warmer. Above the diaphragm is your upper warmer. Below the diaphragm and above the navel is your middle warmer. Below the navel is your lower warmer. So again, upper warmer is controlled by lungs and heart. Middle warmer is controlled by liver and spleen. Lower warmer is controlled by both kidney and liver. So now, liver is playing a role for middle warmer as well as lower warmer. Middle warmer. Again, there you have to use little more a different diagnosis tool, which we learned, tongue and pulse diagnosis. And summarize. Anyhow, treating lip reflex is easy. Where the lumbar reflex comes here, we can put. But to sustain the result, The moment you put, the pain comes, you remove the magnet or seed, the pain will recur back. Why? You're not corrected the energy level. For the lower back, it may be a liver coldness or it may be a urinary bladder heat. Sometimes kidney Chi deficiency, whatever it may be. You can use your third and fourth seed to treat that. Clear? And sometimes you can see some clear changes within 1 or 2 days. Sometimes symptoms will aggravate. Then you should remove that seed. The symptom again will subsidize. Again, to activate ear, you can use different methods. The first most method is needling. If you are good at, you can do it. Or else, needle is not required. Just take auricular seed. It's quite easy, not painful. And one more advantage with auricular seed is patient itself can activate multiple times in a day. Patient itself activate. You can use other methods like giving pressure on the points, color on the points, as well as a few people are also doing massage by using the earbud. That is also fine. Out of all, we go with auricular seed. It's quite easier and effective. If you want to needle, you can use Sujoko needles and you can needle the auricular. So because the entire TM class we learned with the seed only, we are using methi or pepper seed. Here also we are going with the auricular seed. Clear? Anything you want to ask? You can raise your hands. Just I will tell you. This I'm just giving an introduction how we are getting into auricular therapy. Yes, Solanki. Hi.
Hi, sir. Nice meeting you again. Sir, can you repeat about the triple warmer? And can we do auricular on pregnant lady?
Okay, my suggestion, avoid for pregnant ladies. Putting needle you avoid, but you can massage that point.
Okay.
Because massaging is it's quite a lower intensity.
Okay.
Since it is little higher intensity, we avoid for the pregnant ladies. Better if the pregnant ladies is there, for example, if they are feeling too much vomiting, then you just activate liver point like this, just small massage on the liver area.
Okay. Okay. And seats are okay, sir? Means auricular seats for pregnant lady?
And that's what I'm telling. See, it's a little intense treatment.
Okay. Okay. Little
Just
more.
go with massage.
Okay. And sir, triple warmer, please.
I will tell you. Okay.
Thank you.
So we use triple warmer counter. It's also called Sangio. This is we are using to activate the respective area, as well as we use this concept to diagnose also. I will give you a simple one image to understand better. Just look at this image. You'll get idea what is Sanjio or triple warmer. Is it visible? It's a beautiful concept. Look at this. Everything is there. How you are seeing this? This triple warmer. Just you can imagine this as just your kitchen. There's a gas stove, cooker on it, and there is a whistle, paper. Or you can imagine it's as a earth. There is a water, there is a fire, there is a food. Again, there is a preparation. It's like a cooking process. So now tell me, a simple question. If anybody is having very low appetite and hunger and indigestion, where you treat? Which warmer you treat? Indigestion, acidity, very low appetite, heaviness, bloating. So without the concept of middle warmer, we think it's a stomach and spleen, and we directly treat the middle warmer. But look at the image, it's very clearly telling what are all the food which you are loading into this to metabolize it, to burn. It's a lower warmer, the fire. That is what we represent root chakra, the Mooladhara with red color, because it's a fire. You ask any kidney patient, the first symptom of kidney deficiency, kidney chi deficiency, is lack of hunger. If anybody tells, I'm not feeling hunger, if you go to any doctor, first they give some digestive enzymes, some pantacid. If it is not working, then they will go and check the kidney functionality. Why? If anybody tells vomiting, indigestion, and lack of hunger, why the modern doctors are going to test the functionality of the kidney? They don't know this triple wormer concept. They made it research such a way that by doing the research on thousands of people, okay, out of 1,000 people of a kidney patient, so 995 patients having low hunger, low appetite. That's what, that is a one symptom. With that, a mass observation, the modern science people will do the research. But ancient science is much more beautiful than modern science. It has very strong philosophic principle, then understanding of the body with nature. Each and every disease, every symptom, every treatment we do with correlation with nature. That is the beauty of traditional energy medicine course. If anybody having a low appetite, means the burner, the gas, which is not strong enough, that is kept it in the sim mode. If you want to cook very slowly, how you cook? You keep it in sim, no? Yeah, the same thing is happening here. You are trying to increasing the heat in the cooker. It is not possible. Why it is not possible? There is no fire. You do one simple test yourself. Not now, by tomorrow morning. Just press K3 point in the both the legs. 20 times, 20 times. That's it. Another 1 week, check out your hunger, how it is. How it is improving. What is the logic here? To burn the food, you are increasing the fire. To increase the kidney fire, what you are doing? Just pressing K3 20 times. That's it. Nothing else. But how you taken that K3 point? That is because of the concept of triple wormer. One patient came 3 months back. His creatinine is 6.7 and telling all the problems. And doctor told you have to go for wow. Just a minute. Fine. Is he having all the symptoms? He told all the symptoms. Very first symptoms I took is appetite or hunger. Tata made ಎಲ್ಲರಿಗೂ. Tata made. Hi ಹೇಳು. Hi ಹೇಳು. Hi.
New lecturer.
She wants to take class. Take class. Seed ಹೆಂಗೆ ಮಾಕದು seed? Okay. Tata ಮಾಡು. Tata. Okay, fine. No. Okay, come. ತಗೊಳ್ಳವಲ್ಲಿ ಹೇಳು. Okay. Auntie. Okay. Tata madam. ಆಯ್ತು ಮಾಡಿಲ್ಲ ಅವಲ್ಲಿ. You want to take class?
ನೀ ಜಾಣ ಇಲ್ಲ ಬರ್ಮ, ನೀ ಜಾಣ ಮರಿಯಲ್ಲ,
ಜಾಣೆ. Okay. Sorry, we are not working from office, we are working from home. A small disturbance will be there. We'll take it as a small break just to learn better. The very first symptom need to improve in anybody is appetite and hunger, both. Appetite means how much you eat. Hunger means desire to eat. Both are not same. Hunger is a young energy. If you have a fire, you'll get hunger. Appetite is a in energy. If you have a more coldness in the body, you eat more. To digest food, both are required. You need hunger to eat. You need appetite to hold. So, in the most of the patient who is telling very low hunger, indigestion, for them I will rise lower warmer. I use all the techniques to improve the lower burner, to increase the fire in the gas stove. I use color therapy, I use auricular therapy, I use meridian points in all the way. The moment you increase the fire in the stove, the cooking starts. Within a week, patient came back. Sir, one great change, sir. What change? Before I am not at all getting hunger to eat. Now I have a little stimulation in my stomach. I started eating. Then I told, they are putting some mission, dialysis mission before only. I told one word, till how long you are feeling hunger, till that time you don't fix any mission. Why I told that word to patient? How long you are feeling hunger means you are feeling that hungriness because of the lower warmer fire only, not with the middle warmer fire. With the lower warmer fire only, you are getting the hunger. This is in the first weeks. Till third week, the patient urination color is pure crystal white. Pure crystal white. Why? They are not detoxifying. Your elimination system is very weak. Then along with the lower warmer, I stimulated the middle warmer. If food properly digest, then only you can eliminate the toxin. If food itself is not digesting, means you are not creating waste at all. You understood? The urination, which is white in color, turned to pale yellow in the third, fourth week. So, first 2 weeks, we increased the fire. That is the concept we took from the triple warmer. Look at this. Okay, if lower warmer, which is responsible for digestion, means What is the job of middle warmer? What you take from the oven, cooker, from the vessel, what you take? It's a food. Middle warmer is nourishing you. If you put rice or wheat in the cooker, if the stove is switched off means will you be able to nourish your stomach? It will fill your stomach. Not at all. Then when we should treat middle warmer? We should treat middle warmer when the problem arises with respect to nourishment. All vitamin deficiency, losing weight, gaining weight, bone density weakness, all nourishment related, blood deficiency, delayed menses. Menses are getting delayed. Why? Because there is no proper nourishment to body. Your ovaries are telling, nourishment is not sufficient for me. I can't do reproduction. It's not sufficient for me itself. Even though ovaries and uterus are in the lower warmer, to whom we treat for menses issues? We treat middle warmer. Why? Because most of the times irregular menses, it's due to nourishment problem. Liver supplies blood for the menstruation. I agree. I will tell that. But blood is required, na? Parents will tell, she eats 3 times a day. We bring all the fruits to house. She also eats dry fruits. That is not sufficient. Food has to digest, food has to absorb. One who has spleen chi deficiency, they are unable to absorb the food properly. What is the eating 3 times or 4 times a day? Upon that, 90% of the people here, we are eating genetically modified food. That is very weak in the nourishment. Yes or no?
Welcome back, sir.
There is a small issue. My voice is audible?
Yes, sir. Yes.
Right. So I'm just giving example where problem is there in the middle warmer, we treat the lower warmer in the case of hunger and appetite. Similarly, irregular menses or PCOD or early menses or excess bleeding. The problem is there in the middle warmer, lower warmer. We treat the middle warmer. Got it? Like that, many more we do like that, which is in different warmer technique. The same middle warmer you can stimulate through auricular. What an idea? If the person is suffering with upper back pain or digestive disorders or lower back pain or gynec disorders, there is a point in auricular therapy. If you feel the energy which is not smoothly flowing in all three warmers, that can be corrected with Sangio point. So that we learn in tomorrow's practical class. Similarly, I'll give you one more example where problem is there in the upper warmer and we treat the lower warmer. For that, one such example is if a person is suffering with phlegm accumulation in the lungs. If the phlegm accumulation or water accumulation in the lungs, due to that they feel some breathing problems. The problem is there in the upper warmer, in the mist. So what is there in the middle warmer, that is only going to the upper warmer. Yes or no? While cooker making whistle, you see the smell of the food? Yes. Why? Because what is there in the middle warmer, it is coming up. So that time, if anybody suffering with lung disorders or heart problems, so that time you can treat middle warmer or lower warmer to give a best results in the upper warmer. This in TCM it's clearly explained. The entire body water regulation happens through these three triple warmers, Sangio. So that's what in modern science we correlate this Sangio or triple warmer to the spinal cord. Why? Because spinal cord is the organ which covers all three warmers. But technically speaking, triple warmer is not spinal cord. What we call Sangio, it is not exact meaning of spinal cord. Simply few people in Sujok, they correlate to his spinal cord. No. It is a concept of how the water flows in different area. In the lower warmer, water will be there as a freezing, a coldness, as a ice, cold. The same water when it comes to the middle warmer, it is like a boiling water. Do you know how is your hydrochloric acid, digestive enzymes in the stomach? What is the pH value of your hydrochloric acid? How much acidic it is? Your pH value of hydrochloric acid, it varies from 1.5 to 2.5. That much acidic. Means it is the water in the cooker. It's like a boiling water. How is the water in the upper body? Upper body. That water in the form of mist, in the form of vapor. So, how to check this Sangio is good or not? How to check whether given in your body Sangio is working fine? Any idea? To check other organs, we go with meridian, and we go with pulse diagnosis. Any idea?
Heart meridian, small intestine,
Yes, heart
and lung meridian.
the heart and small intestine is representing the fire element, same as Sangio. If Sangio, which is responsible for water metabolism and transformation in the three warmers. The first symptom, if in the lower warmer, Sangio should be, it's too in, and too much coldness. That is indicating strong lumbar area, strong thigh bones and knee joints, plus no issues in the gynec, and all the lower abdomen parts, especially ovulation, sperm ejaculation, and bowel momentum are no issues. That is indicating in the lower abdomen, in the triple warmer, lower warmer, it is in coldness format. If it is in cold form, your bowel won't become dry. The moment it is unable to cool down, your bowel become dry, or it makes excess bleeding, or early ejaculation, or burning sensation, urinary infection, some other. That is indicating Sangio imbalance in the lower warmer. Sangio supposed to be like a ice cold in the lower warmer. If it is not ice cold, if it become little warm, you get the issues like heat related issues. Similarly, in the middle warmer, it should be like a boiling water. If it is like that, the person is having proper digestion, absorption, everything. No cholesterol, no extra blood sugar, and no obesity. Because it's like a boiling water. Anything you give, it is melting out. Similarly, in the upper warmer, Sangio is keeping your water in the vapor format. If the water is in the vapor format, it is moving very freely. Your nose won't block. No nose congestion. No sinus blocks. All upper respiratory issues, throat infection, it is happening because water is not in the vapor format. Then what to do? If you feel Sangio is imbalanced, feeling constipation, digestive disorders, or upper respiratory issues, like congestion, nasal congestion, allergic bronchitis, sneezing, and all. If you are sneezing, means water is not in vapor format, it is in liquid format in the nostril. Yes or no? Then what to do? So I'll show you one point. So look at this. This is the Sangio point. Is it visible to you? Just in the ear, near the ear hole. Just activate this. This is the one point, Sangio. Is it visible, or else I will take some other picture? The black dot. Not only one point, depending upon symptoms of the patient, we use 3 or 4 points. But out of that 4 points, this is the one point for the water metabolism in the triple warmer. So by triggering this Sangio point, you can balance water metabolism, all 3 warmers, so that you can keep water in upper warmer in the form of mist or vapor, in the middle warmer like a boiling water, in the lower warmer like ice cold water. It's similarly how the water we are experiencing in the earth itself. Clear? Any doubts with the Sangio point? Don't worry about other points. I'll give you each and every point. I'll give clear explanation. Without any doubts, you can use each and every points. This is the one point which help you to balance water metabolism. Along with this, you can use second point depending upon where is your symptoms. For example, if your water metabolism is imbalanced in the lower warmer, due to that you are getting frequent urinary tract infection, then you can activate kidney. Got it? If the person is having erectile dysfunction, you can activate Sangio, or along with that you activate external genetical point. There is a, you can check that point with your Sujok Jimmy. It will be sensitive and painful if it is imbalance. Okay. Where to check this? It's very easy. Where this notch ends, no, that is your endocrine point. This notch. This is your endocrine gland. Just above the notch, you just use Sujok Jimmy and give a small, little gentle pressure. The person feel a little sensitive pain. Even you can use this when person is suffering with fever. Fever is also in one indication your Sanjay is imbalance. Or chillness, shivering. That is also indicating the imbalance of your Sanjay. Clear? About triple warmer and in correlation with Sanjio point of auricular. Don't look at what symptom they have. If you feel there's an imbalance in the water metabolism, when you activate Sanjio, depending upon the patient's symptoms. For example, he is having bloating and heaviness sensation in the stomach. Then the second point, you can use stomach or spleen. Minimum points to maximum points 4. That's it. Don't expect more than that. That's enough to give a best results. In these 3 days, practically we are giving the points. Just apply your family members and friends. You can see the great changes within 24 hours to 48 hours. Any doubts with Sanjio point? If the person is having fever, means he is having excess of heat in the upper warmer. Water is too much heat. Just use Sanjio. It will reduce the excess heat and it will maintain a proper water metabolism such a way that lower warmer is cold, middle warmer is heat, and upper warmer is vaporized. Yeah, for Sanjio, you can use for severe cough, you can use lungs and Sanjio. If the numbness and heaviness in the foot, so that is a circulation problem that you can use a liver point. Okay. For sinus, we are showing the point in tomorrow's class. We'll have this. A very good question. ARV Pillai. If diabetic patient is having excess hunger, what we can do? Our TM students will answer for it. Now tell me, after listening this triple warmer Sanjio, if the person is having excess hunger, where you treat? Lower, middle, or upper warmer? Why you are getting excess hunger? Because your lower burner is very, very high. What to do? If your lower burner is burning more, so that it is burning food much faster. After 2 or 3 hours, again you are feeling hunger. What to do? Where to treat? We have to treat in the lower warmer. Kidney or urinary bladder heat is very high. Why that lower warmer heat increased? That is also a question, no? You are not a simple therapist to treat, oh, this is heat. You should give logical reasoning to the patient, then it creates the confidence in the patient. So that with that confidence, he heal faster. Kidney and urinary bladder is connected with marrow, all bone marrow. Any bone marrow is connected with kidney and urinary bladder, which is the biggest marrow in the body. Which is the biggest marrow in the body? It's brain. This brain is the biggest marrow. The another biggest is your spinal cord, where entire spinal fluid is flowing, your kidney essence. The moment person feeling stressful and restless mentally, it is consuming more and more essence. When the essence becomes thin due to stress, the yin will go down, the yang will rise up. Due to that, urinary bladder meridian and kidney meridian both will end up with heat. That excess heat transferring to the middle warmer. That creating the hunger. If you reduce stomach heat, patient feels better only for 1 week. Again he feels same. Then where to stop? Yeah, first thing you have to reduce the lower warmer heat in the urinary bladder and kidney. Second, you should teach the patient. Intellectually, spiritually, you should enrich his mind. Don't run too much in materialistic world. Slow down. Don't run your life. Balance yin and yang. For that, you have to take the food which is rich in essence. Now the younger generation is more stressful than older generation. Why? The older generation, they took a quality food. Since 20 years, most of the food we are eating is hybridized. That doesn't have essence. But your father, your mother, they ate good quality essence food. They are able to bear the stress. You are not. Last week when I visited my village, one person is telling, in our village, all aged people, 60 plus, 70 plus, they are very healthy than younger generation. Who is responsible for it? It's we. Changed our food. And we are feeling restlessness, too much commitment, stressful due to this metropolitan and urbanization. We are not treating the mind, changing the mind. We are not changing the lower warmer heat. Simply we'll put metformin diclomate. Still further it weakens the system. How it is weakens the system? Today you are taking one medicine, after 3 years, 2 medicine, after 5 years, 4 medicines. The number of medicines only is telling you, year by year you are getting weakened. Instead of that, learn the science of balancing triple warmer with food, with thought, with mindset, with exercises, with balancing meridians with auricular and single point. And it is possible. We have not 1 or 2 cases, n number of cases they left medicine for diabetes and they are balancing blood sugar level. So in upcoming classes, we will learn this systematically. We will achieve desired results. Finally, if you are a practitioner, it's my job is to fine tune you, to improve your diagnosis, to get the better results. If you are a fresher also, don't worry. You can learn this from the beginning. I'm not telling you I am not using any technical words of TCM or Ayurveda. I will take you from the zero, and with Joshi Kela group, we will make you a good healer. Okay. Don't rush, don't make urgent. We'll learn one by one concept, food, meridian, auricular point, and we'll reach the destination. Okay. So don't feel hunger, don't feel bad if you have more hunger. We named diabetes. The tagline is given by the mankind. For us, it is not the diabetes. It's a triple warmer, eat is more. We'll reduce it. There are so many different techniques to do it. We have color therapy, auricular therapy, we have different food. With all different togetherness effort, we'll reduce the lower warmer heat within 1 or 2 weeks, maximum 4 weeks. Your hunger will come down. I have so many case histories I can share with you. They're telling clearly, they're testing you in WhatsApp and Telegram. Before I'm eating within 2 hours. Now I'm eating only 3 days a meal. It's fine now. This is enough, no? We can achieve. Okay. So thank you very much. So today I just given what is auricular and how we are treating with integrated approach. Tomorrow we'll start the practical things directly. Okay. So I think here 70% of the people are TM students. I think you can understand much better than others. If you're not TM students also, don't worry. You can continue, you can join again for the TM course. You can learn much more effectively. Thank you very much. Good night.
Thank you very much, Baswara. It's a very wonderful session, very interesting session also. And dear participants, please join the next 2 days classes also without any fail. Because from tomorrow's and day after, you will get more practicals. With the practical, you will get more clarity on the points. So please be with the online classes lively. Thank you very much, Baswara, once again.
Thank you.
Thank you, all the participants.
Thank you, ma'am. Thank you, sir. Thank you.
Thank you, ma'am.
Thank you, sir.
Thank you, sir. Thank you, ma'am.
Thank you.
Thank you, ma'am. Thank you,
Thank
sir.
you.
Thank you, sir.
Thank you, sir.
Thank you, ma'am.
Thank you,
Good
ma'am.
night, all. Sir has left the
Thank you. Thank you, sir. Thank you.
session.
Thank you, ma'am.